name is Sanele Madela. I was born and bred in northern KwaZulu-Natal in South Africa, in a small town called Dundee. I was motivated. I always loved to be a doctor, and I was fortunate enough to get a scholarship to study medicine in Cuba. And I came back and I've been treating patients and working with people. I run a community health care center. I'm a chief executive officer here and also a medical manager. We are seeing patients that are very, very poor. Unemployment rate close to about 54 to 55%. The biggest challenges here, as in the rest of KwaZulu-Natal, we've got a lot of HIV. Then the rest of other ones are non-communicable diseases, which is diabetes, hypertension, that we are grappling with because there was a lot of focus in the whole of South Africa into focusing too much and putting more resources on HIV. And then we left behind the non-communicable diseases that are actually the ones that are now affecting the life expectancies. Storytelling in my background in the Zulu culture, it's something that has been there for years. Because we would sit around the fire and the granny will tell a story and we'll all be attentive and listening next to that fire. Storytelling has been there in our culture for a very long time, but this time around, you are telling a story in a different language, not in your vernacular language. Basically what I learned in the training is actually, one is the confidence to stand in front of the camera to be able to tell the story to the audience. Secondly was to be able to tell your story in different ways. We were playing on the streets with the rest of other kids in the community. And there was this particular young girl that was older than me that was staying as my neighbor. She had these dermatological problems that we could not understand as young kids. One day I came back from school. There was a group of ladies, including my mother, that was sitting around that house gate, and the people were coming in and out of that house, and it was just my neighbor. Then I was shocked to find out that she actually died. I mean, we were just playing the other day and she was sick and I didn't see her going to the hospital or us going to the hospital to visit her. I remember the first time I told my story to the audience, you could see their eyes light up. I feel that they do relate to my story because actually the human experience, what I've learned over the years, is common. What did I learn about my story that actually surprised me was that the emotion about it. After I lived that life, I actually completely forgot how I felt about it. So it reminded me how I felt then. It gave me new emotions of how bad it was. There's no child that can die just because there's just no access to healthcare, and it was completely unfair. So I looked at it that way now as a doctor, that I could have provided help if I was there, you know. The storytelling training helped me a lot when I came back to my work, because majority of the time as a leader of the institution, I normally give presentations and I will give a groundwork before we engage to any topic. I do explain in these meetings. Let's not look at the number that we want to target the screening of about 500 women. We have saved 500 households. That's how you explain it, and you put it out there, and people look at these women not as patients but as the other neighbor that they know, or the sister that they know, or the friend that they know, that they relate their responsibilities that they have to their own lives as health workers. I think storytelling is critical in this day and age. We need to have a lot of people to advocate for our patients, because policymakers, sometimes lots of the decisions that they make are based on the scarce resources, and that's the premise. So the louder you make the noise, the better will be the outcome. So not doing storytelling and advocating for important policy changes and problems that are seen as frontline healthcare workers see in these communities don't have a voice.